Alex, in May, we celebrate Skilled Nursing Week. It starts this year on May 14th. What makes skilled nursing different from other aging services care settings?
That's a great question, Paul. So skilled nursing communities care for residents who have the most intense care needs. So sometimes residents may come from the hospital, and we call that a post-acute care. So they'll go into these skilled nursing communities needing the same intensive care that they would need in a hospital setting, and skilled nursing communities are able to offer that. So skilled nursing communities care for both residents for the long-term or the short-term needs, depending on the community's scope of services and their policies and what they allow in their communities.
For as long as I've been at ECRI, probably before that, one of the most persistent issues we see in skilled nursing is falls. What makes it such a stubborn issue in that care setting?
Falls are very stubborn, they are risky. In skilled nursing particularly, they are very risky and happen frequently due to the higher needs of the residents who live in skilled nursing and the more comorbidities they come with from the hospital setting, or if they live there long-term and need higher skill needs. Unfortunately, falls aren't going away, whether skilled nursing, independent living, home health, they are here, so it's really just how communities handle their falls.
What makes them riskier for older adults? If you or I fell, like, it would be embarrassing, but probably not life-threatening. What makes it so much more risky and dangerous for those older adults?
So you hit the nail on the head. I mean, falls are risky for older adults much more than for you and I. So when an older adult falls, especially if they are to hit their head or have a fracture, I mean, that could be life-altering. And once an older adult falls once, statistically, they're doubled to fall again, which again, really risk, cost, that's scary for the community and the adult. And normally what we see happen, sadly, is once an older adult falls once, then they are really scared to fall again. So they might sit down more and really lose their function and mobility. So it can cause a vicious cycle if we don't have different interventions and therapy in place to help the residents.
So given that these falls are such a persistent issue, been an issue, is there anything we can do about it, or is this just something you kind of have to live with?
Absolutely is not something you need to live with,
okay,
right? So communities can do so much to help manage and prevent their falls. It really starts first with their written policies and documents documenting what you do in your falls management program and how do you prevent falls in your communities. I lead a falls collaborative of 18 member organizations all around the country, and what they've decided to do is really work together in a falls collaborative. And they've come together to share best practices, struggles, interventions, you name it, because they want to combat falls together. So if there's different communities that you trust or you get along with, it's always great to bounce ideas off of them, because what you don't know, someone else might know, and they may offer you new ideas that you haven't thought of before.
In a setting like that, so you do this collaborative, you're going to implement some new interventions. Is it a set it and forget it type thing? I'm going to put some programs in place, they're going to work, and then move on to the next thing and stop thinking about falls?
Absolutely not. So falls prevention is never a one-stop shop. And what works now this month might not work next month. So really it's important to know your residents, know your staffing, and keep evolving your falls management and prevention program. You can always do more. So whether you have an amazing program in place currently, or you want to revise and edit your plan. Or maybe what we see now a lot is staffing changes and staffing shortages. So it's really educating your staff members on how to use your falls equipment. In the skilled nursing communities, there's a lot of lifts. So maybe they want to establish a safe patient handling and mobility program. All that wraps under the umbrella of falls.
And you mentioned that staffing turnover. I'm guessing that combined with resident turnover, yes, that sort of churn is contributing to that constant evolution.
Correct, yes. And education is not only for staff members too. So as you say, residents turnover and their families turnover, also educating residents and their families on falls prevention and how they all play a unique role in helping keep their loved ones safe.
Let's talk a little bit more about that, because it occurs to me that you could take very extreme fall prevention measures, but that would come at the expense of those residents' dignity and autonomy. So how do we try to strike that balance of respecting the patient's dignity and autonomy and also keeping them safe from falling?
Great question. Really knowing your residents is the key. So knowing your residents, who lives in your community, and their history. That's really helpful as well. So what did they do in the past? And then implementing all person-centered interventions geared towards falls. So what works for one resident is probably not going to work for the next. So really knowing the resident, knowing their families, involving the entire care team in conversations around really what matters to that resident and what's important to that resident, and then helping them prevent their falls with what they matter most about or what they care most about.
Alex, thanks so much for doing this.
Yes, thanks for having me.
Thanks for watching ECRI Now. You can find more insights from the experts on YouTube and at ECRI.org. Until next time, I've been your host, Paul Anderson.